Good morning, viewers. Welcome to the fourth episode of Wake Up to Health Talks. A few years ago, there came out a certain video about a teenage boy talking about his addiction with a drug that he called solution. The video is a clip from a documentary called Nashebaz, The Dying People of Delhi, and reveals some horrifying facts about addiction. However, instead of people empathizing with this video and empathizing with the boy, the video went viral for all the wrong reasons. Thanks to the internet trolls, the boy became the subject of various memes and videos in no time. This brings us to the question of the hour. Are we as a society refusing to take addiction seriously? As much as it is a social issue, addiction is a huge medical condition as well. Addiction is not just a bad habit, or it can actually prove to be very dangerous and lead to many health problems and mental health problems. Today, on this topic, we welcome Dr. Abhinav Pandey, a leading psychiatrist from Lucknow, who has been working endlessly with patients suffering from addiction. Thank you, Dr. Pandey, for joining us today, and we welcome you.
Thank you, Apurva, and I thank you for giving me an opportunity to speak on this topic.
Thank you, sir. And sir, just as I previously mentioned, people often, when I say people, me and my friends, we often confuse addiction as a social problem and believe it's just a habit that we need to break. However, it is not so, and addiction actually stems from a deeper, much deeper mental problem. Can you explain to us what exactly is addiction?
Yeah, I agree with you, Apurva. There's lots of misconception about addiction. And the common people, they don't have any knowledge what exactly is addiction and whether who is going to treat them and how they can come out of that. And whether it's a disease or something like a habit kind of thing. Majority of people think it's a habit. And so they always scold their children or scold the people who are into addiction. And they want to make them come out of that. It's not such an easy thing. I'll tell you one thing. Addiction, it's a complex disorder, medical disorder. And when we call it as a medical disorder, there is an amalgamation of multiple things inside that. It's a condition in which brain disease is involved. Brain is involved in that, and it is manifested by a compulsive behavior. A person, he may start with normally with just friends, and once in a while he may start drinking alcohol or anything like that. But slowly and gradually, when he starts taking it regularly, and the consumption increases, the quantity increases, and after a few months and all, he may find it difficult to quit it from that stage. So that is not something which is called as habit. Now the person may develop something is called as addiction disorder. Disorder, when we talk about, it's like a disease in the brain where a person feels compulsive to use the substance despite knowing the bad effects of that substance. So somewhere there are changes in the neural wiring of the brain. We have lots of neurotransmitters in the brain. Let us not make it too much complicated and scientific, but if I explain it in a simple ways, there are lots of neurotransmitters or neurohormones in the brain, which are actually responsible for your thoughts, emotions, and lots of other things which we are doing. And what happens when the substance keeps on going into the body, it goes into the brain. It changes those neurotransmitters, changes the neural wiring system of the brain, and the body gets accustomed to that thing. And finally, what happens when the person is not getting that substance, he feels either withdrawal or a craving or intense desire to take the substance. Despite knowing that that substance is going to harm him, damage the body, damage the brain, he cannot stop by himself because now he's suffering from a disorder of brain which is called as addiction. That is what we, in simple words, if I can explain what exactly is addiction.
That was actually very insightful. I'm sure me and people who are watching this, we actually had no idea that so many things happen in our brain. But as you said, sir, there's a lot of unawareness about this, and one of the problems with unawareness is that how do you identify the symbols of addiction? How do you identify whether I or someone else is addicted to a substance or not?
Yeah, that's an important thing. Because if we know how to identify, I think we can pick them early and
exactly.
get them back to early treatment or rehabilitation. See, very first thing what you can see in the people who are suffering some or other kind of addiction is that there is a change of behavior. There will be change of sleep pattern. There will be change of social interaction, and there are lots of mood swings inside them. And if we see them, every kind of substance will have different kind of dependence. Let me first take an example of a very simple kind of substance which is called as alcohol, which majority of people are using in India and abroad also. And it is legalized. You're not penalized. You're not given any punishment for using alcohol until you're doing it on the road or in some specific places. Otherwise, in the home you can do it. In restaurants. So what happens when a person starts taking an alcohol? He slowly, if he's taking once in a week or once in twice in a month or something like that, nothing much is going to happen. He'll not be called an addict. But if he's taking regularly, and if he's taking every day, and the quantity is slowly increasing, and every evening you see him sitting in a bar or sitting in the room or sitting in the home drinking alcohol, that means he's going through an addiction. You will find him that his socialization will cut down to the people only who drink alcohol, or he'll be drinking alone. Secondly, you feel that his sleep is not very much sound, and most of the time his eyes will be, the eyelids, the bag of eyelids will be swollen, and there will be, drowsiness feeling. He'll have lack of energy. And if he stops taking alcohol, he'll have tremors in the hand. He may have, the tremors. You can see that the body is shaking or shivering, and then the change of voices will be there, and the loss of appetite, loss of sexual desire, loss of interest in the work. All these things will happen. And these things can only be revived if the patient starts taking alcohol in a better quantity. Means if he increases his alcohol content, then he may have some relief because the withdrawal will go down. So what I want to tell is the body gets accustomed to alcohol, and unless he gives that certain quantity of alcohol, he's going to get the withdrawal symptoms. And the withdrawal symptoms can be in the form of physical symptoms like tremors, palpitations, decreased sleep, irritability, and all this. Or they can be psychological symptoms of anger outbursts, depressive symptoms, mood swings, and all these things. So all this, if you see in a person who is having, previously he was a normal person, but after taking substances on regular basis, if he's showing all these symptoms, one can think that he's taking alcohol. But similarly, we have people who take opioids, that is, the brown sugar or the smack, is the most common addictive form, which is easily available in India because, and afim, you can say, in the opium form. So what happens with those fellows? If you see them that they are taking this opioid and all, they always, you can see their eyes are red. The whitest portion, the cornea will be mostly reddish. And what happens that if they stop taking alcohol, they will have severe pain in the body. But they stop taking opioids, then they will have muscular pain. They will have lots of secretions like from the nose, from the mouth, the salivation coming out, and the lots of secretions coming out, and they may have diarrhea because the withdrawal symptoms are similar to some kind of like it is something. If opioid is stopped in the body, a person will not be able to live without opioid for more than 24 hours because unless he gets the opioid, he'll not feel normal. So these all symptoms can happen if the person is taking brown sugar or smack or opioid. Similarly, so there are other substances also like cocaine, and I don't want to go into detail. But if you see overall, if you want to catch a person whether he's addicted or not, what the first thing is his behavior change, that he'll not be behaving normally with people, social interaction will decrease. He'll not interact much with family. He'll try to avoid the family members, avoid eye contact. He'll try to be alone in the room. So inside if you're finding somebody who is cutting down on social behavior, sitting inside the room, not mixing up with people, not going for the work, not getting any interest, and always trying to find a place solitude, then that case what you can see that possibility is that person is going to some addiction. Yeah.
True. And I think at this point of time, whenever someone is addicted, the family tries to intervene or friends try to intervene. And we generally tell them the disadvantages of, addiction to substances. But what I noticed is that we generally just try to tell them that addiction leads to many physical problems such as heart attack or cancer or heart diseases. But when I was doing my research online yesterday, I actually read something very interesting where they said that addiction can also lead to a lot of mental health challenges. So I just wanted to discuss that with you. Is that so? Does it also lead to a lot of mental health challenges?
Yeah, I think the physical manifestations of alcohol, of any kind of addiction, is known by most of the people. But mental symptoms only they come to know after a certain amount of time only. Alcohol causes lots of damage in the body, including the brain. Brain is the most important vital organs we have got. And the problem happens is that regular intake of any kind of substance, whether it's an alcohol, cannabis, opioid, anything like that, it changes the brain system. The brain gets adapted to that substance. And what happens is patient may have two kinds of symptoms. If he regularly takes substance, he may develop sometimes of depression, Sometimes it causes some kind of affective disorder like mania, and where he talks too much, aggressive, violent, aggressive. He may sometimes develop symptoms of psychosis, which we called as unrealistic feelings and unrealistic thoughts and processes. And if if he's not getting the substance, then he may go into withdrawal symptoms. Withdrawal is when the body is not getting the substance and the body craves for the substance. Then in that case also patient can go into depression, anxiety, or mania, or like excitement phase, or aggressive phase, or sometimes unrealistic talks or psychotic symptoms. So all these symptoms can happen both in the case of if the patient is regularly taking the substance or if he is not taking the substance. One is the cause of substance, one is the withdrawal of substance. So both are dangerous. So until unless we do a treatment process, we keep the patient in rehabilitation, we do some anti-craving drugs and reduce the withdrawal symptoms, we will not be able to control these symptoms. So if you want to go for the brain per se, we talk about the brain. Most of the mental disorders which we know, which are independently found in patient, can be found when they are taking these substances, and that can be caused just directly because of substance. So to be very clear, one can get a depression without any reason, but if he has got a disease of depression, and person can also get depression if he starts taking alcohol for a long time, and that depression is caused because of alcohol. So this is something which is actually you were not born with the disease. It was not genetically induced in you, but because of taking a certain kind of narcotic substance or alcohol, you develop that. That is some drawback of taking these substances for a longer time.
But so now this actually conversation made me think whether it works the other way around. If suppose someone I know is suffering from a mental health challenge, can that lead to addiction?
Yeah, that's true. See, when we have done lots of research on addiction, lots of scientists and all over the world and psychiatrists, they sat together and found out the causes of most of the cause of addiction. Why the person is going to addict? Why in a family, if there are three brothers, one is all three have got the same environment and the same parenting and same schooling, same kind of friends, but one will get into addiction, other will not. What will be the reason behind it? True. Then they studied the brain and the process and all this. They found that what happens is majority of people who go into addiction, they are actually doing it for compensating their psychological disturbances. For example, if somebody is suffering from anxiety symptoms, let me explain what exactly is anxiety. Anxiety means the person feels very worried, very anxious, and he has lots of overthinking. He gets fearful in certain situations without any specific reasons. There may be palpitations, tremors, sweating, and some people may find it more often when they are into some kind of situation where they are with strangers or with social people. These all things are symptoms of anxiety. They can normally happen in people who have anxiety disorder. What happens is when the person of anxiety disorder takes alcohol kind of thing, they get a little bit of relaxation because of the relaxing part of alcohol. Alcohol also relaxes a little bit of brain, but it is only for the short term, not for the long term. So what happens is when they get relaxation, they start feeling better after taking alcohol. So they take it on regular basis. Then they start taking it from the morning time to the evening time, and slowly and gradually they become addicted. And they think that this is the treatment they are giving to themselves. But they don't know that in the long term, alcohol is not going to reduce their anxiety. It is going to cause increase in anxiety. Apart from that, damaging other parts of the brain and body. Till now, we have not found any single benefit of alcohol. So most of the damages which the alcohol does is as we know that it's on the liver and the kidney and all these things. But the brain is the most susceptible part which gets affected in a high manner. Because what happens in the brain is if you are not abstinent for a long time, you cannot reverse the effect of the alcohol which has damaged the brain. And whereas in liver and all these things, if you abstain for a certain amount of time, the damages can be reversed. Brain, the damages are a long-lasting damage. There will be lots of impairment in memory, lots of impairment in judgment, and lots of impairment. What happens like if acutely somebody takes alcohol, he may have judgment impairment, he may meet an accident while driving. But if you're chronic alcohol, a person who's regularly on alcohol, he may adapt to the situation of alcohol, he may adapt to the alcohol quantity. But what happens is his cognitions, his executive functioning, his attention, concentration, memory, and reasoning, all these things will get impaired slowly with time. And that will have a long-term effect on his brain system. So I think majority of patients people who are taking one or other kind of substances are suffering from some other kind of psychiatric disorders. For compensating those psychiatric disorders, they are taking these substances to cure by themselves. Without meeting a doctor, they want to cure themselves by taking these substances. And a person with anxiety is more prone to take alcohol. A person with depression is more prone to take things like cigarette smoking and all, because nicotine will give a little bit of relief for some amount of time. So he feels better euphoric on that. And sometimes they start also taking cocaine and all to just for a novelty seeking thing, because people who are actually bored with situations, who are not very used to monotonous situations, they want to get thrill by taking some substance, or some kind of novelty seeking experience. Like they want to have something new, something different, which can change their perception. So without doing anything significant in the life, they want to do it, get it done by substances. We can get all these thrills if you want to do some adventure. You can go into sports, one can go into some other kind of, creative activities and get passionate about that, and you can get that thrill. But these people, they want to get the thrill just by taking a substance. They take LSD and they get thrill immediately. LSD is is a very common thing which causes hallucinations and all. So I think that's one of the reasons they are vulnerable people. They are not normal people. So one needs to screen the people who are taking some kind of substance to find out what exactly are the cause. One major cause I'll tell you is a disease called as attention deficit hyperactive disorder. And this is a disorder which people have difficulty in paying attention. They are very hyperactive and they are very impulsive. These people are found to have a high possibility of going into substance use disorder like alcohol or cannabis or opioid, or all this, whatever kind of substances are there. So what we have seen when we screen these kind of people, we find that they are treating themselves. They are just trying to help themselves by their own methods, by taking the substance. The best way should have been that they should have consulted a doctor and he should have prescribed some medicine and treated their disease without all dependence on these substances. Then that would have caused some benefit to them. But here they are treating by themselves. So I think one of the major cause which you have told is, I agree with you, is this substance use. There are always an underlying cause of some kind of psychiatric disorder.
Some disorder, which this actually brings me to my next question, sir. As you said that they should actually seek help outside and just not to try to treat themselves. So if suppose I see my friend suffering from some kind of addiction, what are the steps that I can tell them, or what are the steps that you would tell our viewers, that how can they de-addict themselves, or how can we support our family members or friends from when it comes to de-addiction?
Yeah, that's a very important question, because until as we know that, we are not going to help them out.
Exactly.
First thing, one needs to acknowledge it and accept it that this is a kind of disease. This is the first step. Until unless you accept it as a disease, you'll never go for treatment. You'll always think that's a kind of habit, and by scolding them and by beating them or by abusing them, you can stop them, and nothing is going to happen with that. You have to accept that it's a disease, kind of disease of the brain. Second thing is, one most important thing we do is as motivation enhancement therapy. We want to increase their motivation. To the motivation, because majority of addicts, they will think that they cannot do it. It's impossible for them to come out of. And one has to, increase their confidence by motivation, by this kind of therapy, this kind of counseling is done, where we always tell them that it's possible, and many people have done that. And we also ask them to go for group therapies. Lots of group therapies available in every city. There are lots of people who have already, come out of this addiction process. They meet as a groups. And then they talk about their experiences and how they were addicted and how they come out of that. This kind of inspirational stories are there, which are actually real life stories, which make them believe that they can also do that. Third thing is, the major problem in this alcohol, any kind of substance, is that people go back into that same kind of pattern after a few months. Whenever they have some kind of stress, whenever they have some kind of emotional problem, then they again go back to the addiction process. So what we need to do is a relapse prevention. This is called as relapse. Relapse means you were taking alcohol, you were taking some substance, and you were addicted to that. And after some amount of treatment, therapy, or by self-motivation, you stop that. But after a few months, again you going back to the same pattern. That's called relapse. So to prevent relapse, we have to always focus on 4 things. What are the cause of relapse? The majority of time it is seen that cause of relapse is, initial days it is a withdrawal. Like if you stopped a substance, you're going to have a severe withdrawal, especially with the opioids and all. And you again go back to taking that substance. Then another thing can be a craving, that you have intense desire to take the substance because you feel that it is, until you take it, you cannot function normally. Third thing is a euphoria or dysphoria, means where you feel depressed or low because of certain life situations, like somebody's girlfriend goes away, somebody's boyfriend goes away, somebody has a problem in the studies and employment problem, anything like that. and he goes back into that same addiction pattern to deal with that. So he's using it as a defense mechanism to deal with his addiction process, to deal with his real life situations. And another one is we call it as Q related. Q means, like, what happens is, like, if some person who is addict, he stops taking alcohol or substance. After a certain time, he meets a person who's taking the alcohol, or he sees in the video of people taking or enjoying alcohol or taking any kind of substance, or he sees in some advertisement of these things. Then he starts feeling a craving for taking it again. This is called as Q. So we have to stop all these. We have to train the person how to deal with these things. These all are therapies are for that. And we psychiatrists, and along with the help of psychologists, we do these therapies so that patient comes out of these things. And initially we give some medications also, so that person does not have withdrawal. So if the withdrawal is delayed or withdrawal is curbed, patient has a high chance that he'll go into the next stage. So we can increase his motivation, we can stop the withdrawal, we can deal with these things like the emotional issues and all by alternative treatment method, by medicines or by therapy, not by substance. And somehow we can deal with that thing. So, and if you somebody finds anybody in the family as suffering from addiction, he should bring him as soon as possible to a psychiatrist and ask him to evaluate the person. And if he needs medications and therapies, he should be given that, and that will help out that person. Side by side, keeping the environment of the home very healthy and friendly, and always do not blame the person, because nobody wants to become addict. They have gone to a chain of process where they are not coming out of themselves. So we need to help them out. We need to give them, we can give our hand so that they should come out of this kind of meanness. But problem is, if we start accusing them, if we start abusing them, they will feel more disheartened. They will not open out. They will not come for help, and they will go into the depth of into deep addiction process. And that's very difficult to then come out of that.
That's true, sir. Thank you so much. Thank you, Dr. Abhinav. I think that has been a very insightful conversation. And, the two nuggets that I would take from this conversation is that it's very important to support your friends and family, and to identify addiction as soon as you see the signs and symptoms, and seek a professional help. That, I think, is the most important factor that you can take in while helping someone de-addict from substances. And thank you, Dr. Abhinav Pandey. Thank you for joining us. And just to conclude, it has been a great session. And we just have to make sure that our youth and everyone in this country remain healthy, because a healthier India will only lead to a stronger India. Catch you in the next episode of Wake Up to Health Talks. Thank you so much.
Thank you, Apurva. And it was a wonderful session. And I think somewhere, down the lane, we have to understand the fact that nobody wants to get into addiction. It's all because of certain circumstances and situations. People go into addiction, and we all need to help them out to come out of this meanness, so that as a healthy people and as a healthy citizens of this country, we can have better goals and we can reach to a developmental level of where we can do some productive things instead of going into that addiction process.
Thank you. Absolutely, well said, sir. Thank you so much.
You.